Thank you for the opportunity to present this paper entitled 3-Year Post-Treatment Outcomes Following Completion of Peanut Oral Immunotherapy. My name is Paxton and I'm presenting on behalf of the co-authors. The probiotic peanut oral immunotherapy 003 study is a 3-arm multicenter randomized controlled trial evaluating probiotic and peanut OIT, peanut OIT alone and placebo over an 18-month treatment period. At the end of the study, there were 3 possible clinical outcomes. Remission is when a participant passed the end of treatment challenge and also another challenge after 8 weeks of peanut avoidance. If they are desensitized without remission, they passed the first challenge but did not pass the second challenge. If they're allergic, they fail the end of treatment first challenge. In the PPOT 003 LT study, which is a long-term study following up participants who finished PPOT 003, participants were invited back yearly to evaluate their post-treatment outcomes at first year, second, and third year post-treatment. In terms of instructions for peanut intake, if they were in remission, they were asked to eat peanut freely in their diet. If they are desensitized without remission, they were asked to eat 2 peanuts daily. And if they're allergic, they were asked to avoid peanut in the diet. The endpoints for the long-term follow-up at 3-year post-treatment were outcomes that were analyzed a priori. We looked at peanut ingestion patterns, peanut reactions, and quality of life. These were analyzed by clinical outcome group and also by original treatment allocation. In terms of peanut ingestion patterns, the median frequency of peanut ingestion in the remission group was 1 to 2 times a week, consistently across all 3 post-treatment time points, and as well as the median amount of peanut ingestion was 3 to 8 peanuts, again consistently over 3 post-treatment time points. In terms of the desensitized without remission group, the daily peanut ingestion decreases over time with increasing difficulty in maintaining adherence. If you look at the comparison of peanut reactions by the clinical outcome, we can see that reactions were much higher in the desensitized without remission group of at least more than twofold of 27% as compared to 12% in the remission group at 3-year post-treatment. There were no moderate or severe reactions in the remission group as compared to 16% moderate and 11% severe in the clinical outcome group of desensitized without remission. Those in the remission group did not require any adrenaline injector to treat any reactions, whereas 6.1% in the desensitized group required that treatment. In terms of the quality of life comparison between clinical outcome groups, you can see the greatest improvement remained in the remission group as compared to all the other time groups as shown by this forest plot here. Comparison by treatment allocation showed that PPOT and OIT participants were still consuming peanut as instructed at 3-year post-treatment, whereas there were 15% accidental ingestion in the placebo participants. Overall peanut reactions were decreasing over time, with PPOT 16% and OIT 17%. Adrenaline injector usage was low in the active groups, and as well as the active groups showed clinically meaningful quality of life improvements compared to placebo. In conclusion, at 3-year post-treatment by clinical outcome, remission participants on free intake experience fewer and less severe reactions compared to those who are desensitized without remission. Reactions in allergic participants remain steady, similar to what was reported in community cohorts, and as well as quality of life improvement remained greatest in remission participants. By treatment group, reactions continue to reduce over time in both PPOT and OIT groups, and as well as these 2 groups showed lasting quality of life improvement compared with placebo. Thank you.